Hello, and welcome to today's episode of the ALS United Mid-Atlantic Goals podcast. If you've listened to past episodes, you know that we've spoken with people from a variety of perspectives when it comes to ALS, from caregivers to people living with ALS, researchers, advocates, volunteers, and everyone has a different story to tell. Today we're going to be discussing a crucial topic: observational studies in ALS research, what they are, why they matter, and how they're advancing our understanding and hopefully treatments of this complex neurodegenerative disease. Joining us today are two wonderful guests who I'm excited to talk with and share their stories, Myah Stone and Emma Allen, who are members of the outreach team at the ALL ALS Research Consortium.
Thanks so much for having us, Tony. I'm Myah. I'm a patient navigator at the West Coordination Center at the Barrow Neurological Institute in Phoenix, Arizona.
And I'm Emma, a patient navigator for the East Coordinating Center at Massachusetts General Hospital, or MGH, in Boston. And we're excited to be here with you today, Tony.
We're thrilled to have you both. And speaking of MGH, I encourage people here to listen to a recent podcast we did with my friend Rochelle Green, who talked about some of her clinical work she did at MGH. So we're all collaborating and coordinating across the ALS community globally and nationally to support clinical trials and research. So we're thrilled to have you. To kick things off, can you please tell us what you're going to be talking about today on this podcast?
Yeah, sure. Emma and I are here to talk about important ALS research. For listeners who don't know what ALS is, it's a progressive neurodegenerative disorder that causes damage to the body's motor neurons, which are the nerve cells of the brain and the spinal cord that control voluntary muscle movement. There's a lot we still don't know about the disease, which is why research is so valuable. Today, we'll specifically be discussing observational ALS research and the importance of the work that we're doing through the ALS Consortium.
That's great. And I know we have a lot of things to talk about, but can you just give a little bit of background about your work and your interest in ALS research so people know a little bit about you at both? So Myah and then Emma.
Yeah, so I have a background in global disease biology. I'm actually currently pursuing a master's in public health as well. My academic and professional interests have always centered around understanding disease from both scientific and community perspective. While I don't have a personal connection to ALS, I was drawn to this work because of the impact and the opportunity to support research that prioritizes participant experience, accessibility, and long-term change. Being a part of the ALL ALS Consortium allows me to contribute to meaningful research efforts that can bring us closer to understanding this disease a little bit better and one day preventing ALS.
Yes, and I graduated with a degree in general biology in 2020, and since then I've done a lot of things. I've sort of bopped around. I was in cancer research for a time. I did data management with them. I've been a healthcare assistant and did more just like in clinic, and I found that just in general I love all healthcare spaces, particularly research though, and so I did eventually find my way back to research, specifically in the ALS space. And similar to Myah, since I've started working here as a patient navigator in this space, I've come to really appreciate all the research that's being done on ALS, and just I've loved the community that I've been able to talk with, and I've been going to events and meeting people within the ALS community, and they've really made me feel impassioned about wanting to make change.
That's great. I think it's so important that our community knows that people like you are really invested in the progress towards treatments and understanding ALS. That's how people feel trusting the people who are doing the research. And I know a lot of our researchers, all of them, really care about the results and what we learn here. It's not just that science is interesting, which it is, but really good people are working on this behind the scenes at all levels, from fundraising to neurologists and everyone in between, to get us closer to new treatments and to end this disease, or as you said, Myah, maybe preventing it or slowing down progression from the start. We have a lot to cover today on this topic. For those who are listening or watching who may not have the time to tune into the whole episode, though, is there a way that they could learn more about ALL ALS outside of the podcast?
Yes, so listeners, they can learn more by visiting our website. First and foremost, it's www.all-als.org. On this website, there's a ton of great information on the program there. There's also a program overview. There's eligibility criteria. We have some digital pamphlets and brochures, and even some recordings of community webinars that potential participants can go and watch. And if you're interested in participating, or if you just want to learn more, the website also has our participant interest form right on the homepage.
Great. And we're going to link to some of that in the description here on our pages so people can find that. And we want to make sure people can get the information as they need so they'll learn more about you all. Let's start with the basics, though. Tell our listeners and our ALS community what All ALS is and what inspired this initiative.
Absolutely. The Access for All in ALS Consortium, or All ALS, is a national research effort that's transforming the way we study and understand ALS. It was launched with the support of the National Institutes of Health and brings together 32 clinics, two major coordination centers, so MGH, which is where Emma comes from, and then BNI in Phoenix, which is where I come from, as well as a team of researchers, doctors, and partners from around the country. The idea behind all ALS is simple but powerful. We need better tools to understand the disease, and to do that, we need to have better data. So, through this initiative, we're collecting detailed health information, biological samples like blood and spinal fluid, and digital and remote health measurements from people living with ALS, people who are genetically at risk of developing ALS, and their family, friends, and caregivers. This is done through two key observational studies.
Wonderful. Now, that's a really important overview of All ALS. I have a more general question now. Earlier, you mentioned that All ALS is an observational study, and I don't know if people understand what that means. So, can one of you explain what an observational study is and why it's so important?
Yes, great question. When most people think of clinical trials and research studies, they tend to think about interventional trials. And interventional means that a study is giving their participants a drug, device, or therapy, and researchers are measuring if that intervention is effective at slowing, preventing, or halting a disease or disorder. An example of an interventional trial is, or specifically within the ALS research community as well, is Healy Platform Trial, which has tested the effectiveness of 7 different drugs across its 7 different regimens. Now, All ALS is an observational study, which means we're not testing any treatments or interventions. Instead, the focus of the study is to collect data and biological samples from participants over time. It might sound simple, but it's incredibly powerful. Observational studies help us build baseline understandings of ALS, things like how it progresses, what biomarkers might predict its course, and how it varies between individuals. And without that kind of foundational knowledge, it's really hard to develop targeted, effective treatments down the line.
And for those listening, you can find some past videos from our Help and Hope symposium or from our previous podcasts about things like the platform trials that are ongoing at some of our local treatment centers. So, what types of data and biological samples are collected for observational studies?
Yeah, the types of data and biological samples collected vary depending on the study, so
Mhm.
let's focus on those specific to ALS. First, researchers collect basic personal and health information like your name, address, current medications, family history, and medical history. By collecting this information, researchers can create a holistic understanding of a person's health status. Then there's more specific clinical data. That can include physical functionality tests like breathing tests, genetic testing for ALS-related genetic variants, and cognitive, behavioral, or environmental questionnaires and surveys. These types of tests include a broad range of data collection and can cover many research bases. For example, breathing tests and questionnaires that focus on physical function can provide a lot of information on disease status and progression, whereas social or environmental questionnaires can be helpful in discovering potential disease risk factors or tracking psychological well-being. And then on the more biological side, ALS research studies tend to focus on blood, saliva, and spinal fluid collection. Saliva can be used to conduct genetic testing, and blood and spinal fluid are extremely valuable for conducting further research on ALS and discovering potential drugs and treatments. However, there are studies that collect different biological samples as well, such as urine or stool.
So, if observational studies don't involve testing a drug or treatment, what's the purpose of them?
Yeah, with an interventional trial, the purpose tends to be more straightforward. You are receiving some type of intervention or perhaps a placebo, and researchers are measuring whether it slows, halts, or prevents a disease. Observational studies, on the other hand, lay the groundwork for future biomedical breakthroughs. The data and biological samples collected during these studies are stored in data portals and biorepositories where they can be accessed and shared among researchers. Without these vital resources, research cannot move forward. They are a foundational component of scientific discovery. One of the best known examples is the Framingham Heart Study, which began in 1948 and followed thousands of residents of Framingham, Massachusetts, over several decades. This study didn't test any drugs or treatments, it just observed health outcomes over time. Yet it's because of that study that researchers first identified major cardiovascular risk factors like high blood pressure, high cholesterol, smoking, and physical inactivity. That kind of discovery wouldn't have been possible without long term observational data.
It's really exciting to me working in the ALS space because I have seen how the collection of data has evolved so much over the years. With computers and different insights, there's so much more that you can get and that can be effective. So, what can researchers do with the data and samples collected in observational studies?
Yeah, a lot. And to go through all the avenues would take many more podcast episodes. So today we're just going to focus on biomarker research.
It's really important. And I know that for many years, people have been talking about wanting to find more biomarkers. And it's really a hot topic for research in general, not just for ALS. So it's really fascinating. Can you walk us through what biomarker research involves?
Yeah, and for those who may not know what biomarkers are, they are measurable biological factors within our bodies that can be useful indicators of disease. So researchers can measure specific biomarkers and determine if a disease is present, how a disease is progressing, and how a disease is responding to potential treatment. Common examples of biomarkers include blood pressure, blood type, protein levels, genetic variants, and any other biological factor that can provide information on the status of a disease. In the context of ALS, one of our big goals is to identify reliable biomarkers that could help diagnose ALS earlier, as well as track its progression or even predict how someone might respond to a particular treatment.
It's really important and really interesting to our audiences as well, as they want to see how effective their research dollars are going and that research is going in general. So, can you explain the usefulness of biomarker research in more detail?
Of course, yeah, biomarker research is a big topic, so let's break it down a little. It's important to note that all research, including biomarker research, is incredibly broad, and this is by no means an exhaustive list of potential biomarker research. But today we'll focus on how biomarkers can aid in the understanding of disease origin, disease progression, and disease treatment or prevention. So let's just start with disease origin. Much about ALS remains unknown. About 20% of people with ALS have a known genetic cause, but the other 80% are considered sporadic, meaning there's no clear explanation for why ALS occurs, and they also don't have a known genetic link. If researchers could identify biomarkers that appear before symptoms, it could pave the way to earlier and faster diagnosis. That means earlier access to care, more time for individuals and families to plan for what's ahead, and could even open the door to starting treatments sooner.
It's so important and useful. So, what about advancing our understanding of how the disease progresses over time?
Yeah, so biomarker research can help with understanding disease progression by identifying which biomarkers reflect how a disease progresses over time. Researchers can develop better tools for predicting and managing symptom changes. So, for example, in ALS, this could include researchers learning about speech and vocal changes over time. And this kind of insight could lead to the creation of new technologies that could help preserve speech for as long as possible.
And again, for those listening, I encourage you to listen to some of our past episodes where we did talk about some of these biomarkers and some of these studies that have been evolving that we've been able to help support and that some of our patients have been involved in. So it's very positive and encouraging work. So, how can biomarker research aid in developing treatments or preventing disease?
Yeah, to know whether a drug or therapy is useful at slowing, halting, or preventing ALS, researchers need a measurable change in a disease-related biomarker. One great example is a recently discovered biomarker that has proven extremely useful in assessing ALS patients' response to treatment, which is neurofilaments. When motor neurons, which are specialized nerve cells that transmit signals to muscles and glands, are damaged or die, neurofilaments are released into the various fluids of the body, including the spinal fluid and the blood. So, if someone with ALS is receiving a treatment, researchers can track how the levels of neurofilaments in their body change over time, and a slower rate of neurofilament exchange in response to a drug or a therapy would suggest that the rate of motor neuron damage and death has slowed, indicating a slower rate of disease progression.
I appreciate how you put that into English. That's something that I think our audience can understand and I can understand. That's not a complicated way of putting it. Drug and therapy development is a long and complicated process. Can often take many years and a lot of money. Are there other ways that biomarkers can help in developing new drugs and therapies?
Yeah, a lot of ways. Biomarkers play a huge role in helping researchers and pharmaceutical companies develop new targeted drugs and therapies as well. And so, targeted means that the treatments are designed to interact with a specific biological feature, something researchers identify through biomarker research. So, a great example of this is a drug called tofersen, otherwise known as Qalsody, which was approved by the FDA in 2023. Tofersen has been shown to improve ALS symptoms and slow disease progression in people whose ALS has been linked to a genetic variation in a gene called SOD1. When the SOD1 gene is mutated or is slightly different, it causes nerve cells to produce harmful and abnormal proteins. These proteins can build up over time and damage the cells, which can lead to ALS. Tofersen works by targeting the RNA made from the mutated SOD1 gene and blocks it, which reduces the production of these toxic proteins. This can slow disease progression, and this kind of treatment wouldn't be possible without understanding the underlying biomarkers involved in the ALS progression, so SOD1.
I really encourage anyone who's interested in that particular therapy to go back and listen to our recent podcast with Rochelle Green. She participated in the clinical trial for that. And actually, she was involved with MGH. So she had gone and done some work there. So she can tell you about her patient perspective on that study and that therapy as well. Since the research that results from observational studies leads to the development of new drugs and therapies, could it be that observational studies are directly linked to interventional trials?
Yes, undoubtedly. And I think that's what's interesting. People often see the value of interventional trials, of course, but they underestimate the critical role of observational studies. The truth is that every interventional trial is built on the foundation of observational research. It's a chain reaction.
Mhm.
So, observational studies collect the data in biological samples for the sake of research, which leads to drug and therapy developments, which leads to interventional trials, which leads to further research, and the cycle can begin again. If you cut off the head, the body dies, meaning if people aren't enrolling in observational studies and pooling these necessary data and biological samples, interventional trials cannot and will not happen. Observational studies are a vital component of scientific research, and our understanding of ALS and its potential treatments can't evolve without observational studies.
Wonderful. Are there other ways that interventional and observational studies can be linked?
Yes, and just one example is that some interventional trials use observational data instead of recruiting a traditional control group. So, in a typical interventional trial, there are usually two groups an experimental group, which receives a treatment, like a drug or a device, and a control group which does not receive this drug or device. This setup helps researchers compare outcomes and see if the treatment works. In most interventional trials, both the experimental and control groups are created by enrolling participants and following them throughout the duration of the trial. However, sometimes researchers will choose to use existing observational data, information gathered from people outside of the trial, and this is known as an external control group. And they do this to compare this external control group to the experimental group. This has several benefits. For one, it can significantly cut costs. If a trial cannot afford to study and follow up with a large number of participants, the research team can cut costs by only enrolling participants in the experimental group and using an external control group. Another benefit is that more participants can receive the actual treatment being tested because participants are only enrolled in the experimental group and would not potentially be enrolled in the placebo group. Interventional trials could not employ this strategy if good quality observational data had not been collected in the past.
So, what would you say to someone with ALS who's only focused on enrolling in interventional trials?
Well, first, that is completely understandable, and I would encourage them to identify the right interventional trial for them and dive in. However, at the same time, I would try to give them some perspective on the flexibility and importance of observational studies. Just to highlight the flexibility, typically people can participate in both an interventional trial and an observational study at the same time. And sometimes observational studies can even be done completely remotely from home, and they don't need to go into clinic, which can be nice. And I can't stress the importance of observational studies enough as well. They are the engines that drive innovation in clinical trials, from new endpoints to new drug targets to exciting new biomarkers. They really pave the way for exciting new trials for ALS. Thus, participation in these types of studies is so important for all people with ALS, and participation in observational studies can yield new discoveries today and for years into the future.
I know from talking with a lot of our patients that being part of research is really empowering. So, whether that is an interventional trial or observational research, just being part of a study or advancing that is really empowering when a disease can take away your physical strength. So, I think no matter what you do, if you're involved in those studies, it's really important. But now that we understand why a program like All ALS matters, can you share a little bit more about its specific goals and what All ALS is aiming to achieve?
Yes, I can talk about that. I want to give Emma a little bit of a break, but All ALS has multiple goals, all centered around accelerating ALS research and making it more impactful. As mentioned previously, one goal is to build the largest collection of ALS-related clinical data and biological samples to date. This data set will be shared securely amongst researchers and in time will hopefully lead to advances in our treatment and understanding of the disease. Another big goal is data harmonization, which essentially means connecting all ALS data with the data and digital information from other ALS research studies in the past. By combining the data sets and removing redundancy, we can get a clear, more comprehensive picture of ALS and ensure maximum impact of the collected data samples. Another one of all ALS's goals is to make research more accessible. So by providing people living with ALS the opportunity to participate remotely, as Emma mentioned previously, and engaging in a larger portion of the ALS community through extended outreach initiatives as well. And finally, we're looking at whether tools we're currently using to track ALS progression really reflect what matters most to the ALS community.
Thanks so much. Making research more accessible is so important, especially for the ALS community. Like you both said, if you are living with ALS and you are in a power wheelchair or don't have access to a van, it can be really hard to participate in things. So, having people who are working on these studies, observational or interventional, and making sure they're accessible, means that so many people with ALS can feel empowered and be part of the solution. It's clear that all ALS is laying a strong foundation for meaningful research and advancements. But how is all ALS structured to collect this vital data and these biological samples from participants?
Yeah, well, all ALS is separated into two observational research studies. We have assess and then we have prevent. And although their structure is similar, they are a little bit different.
All right, so I guess we should start with assess because it comes first alphabetically. And can you tell us a bit about what that study involves?
Sure. So Assess All ALS is designed to enroll people living with ALS as well as control participants. This can be friends, family, or anyone in the community who isn't living with ALS but wants to get involved. The main goal of Assess is to track how ALS progresses over time. To do that, we collect routine clinical data, things like breathing and muscle functionality tests. We also collect questionnaires and biosamples like blood and cerebral spinal fluid. This gives researchers a clear picture of what's happening in the body as the disease progresses.
Interesting. So, if one of our listeners was interested in joining the ASSESS study, what would their schedule look like?
Well, it depends on whether the participant is living with ALS or joining as a control participant because we have two cohorts. People living with ALS have visits every 4 months, while control participants have visits once a year. Both groups of participants are additionally required to complete monthly digital speech assessments and questionnaires, which can be done right from the smartphone or the computer. I touched on this a little bit earlier, but what's really unique about Assess is that it's designed to be accessible for all. People living with ALS can either attend in-person visits by traveling to a site, or they can choose to participate completely remotely at home. For remote participants, all visits are completed via internet platforms like Zoom, and blood collections are completed at home by trained and certified nurses. By providing this remote option to participants, we hope to involve more of the ALS community and make it easier for them to participate in research. However, it is important to note that this remote option is only available to people living with ALS, so control and prevent participants need to travel on site at least once a year.
Great. So, what about Prevent? What is that like?
Yeah, so Prevent is it's really exciting and important part of the All ALS initiative. While Assess focuses on people living with ALS, Prevent is designed for people who are at genetic risk of developing ALS but aren't showing any symptoms yet. That includes individuals with known ALS related genetic mutations or those from families with a history of ALS. The goal of Prevent is right in the name, to understand the earliest changes that occur in the body as a result of ALS before symptoms occur. This is a critical piece of ALS research puzzle, as most of what we currently know about ALS comes from studying the disease after patients have began experiencing symptoms. If we can identify early biological or clinical signs, we can potentially diagnose sooner, intervene earlier, and even prevent disease progression. Ultimately, Prevent is about finding answers that could lead to earlier detection, better outcomes, and a future that we can halt, treat, or prevent ALS entirely.
Terrific. So, what does the schedule for a Prevent participant look like for someone participating in the Prevent process?
So Prevent is pretty similar to Assess when it comes to the types of data and biological samples collected, including the clinical data, blood and cerebral spinal fluids, digital questionnaires, speech assessments, etc. However, the Prevent schedule is a little different. Prevent participants have to be seen every 4 months for up to 3 years, and only the baseline visits, so year one, year two, and year three visits, are in person. All other visits are completely remotely. Another unique part of Prevent is that it has an optional sub-study. So this allows people who have not already been tested for ALS genetic variants to talk with a genetic counselor, and if they choose to, undergo genetic testing.
So, it sounds like a lot of people might qualify to join All ALS. So, if one of our listeners is interested in participating, where should they go to get started?
Yeah, so first off, I'd like to say thank you to anyone considering getting involved. Every single participant really matters and makes a difference to ALS research. The best place to start is the All ALS website. So this is www.all-als.org, as mentioned earlier. There you'll find the participant interest form, which collects basic information such as your name, email, and phone number. Once you submit the form, Emma and I, as patient navigators, will be notified. We'll reach out to answer any questions, address any concerns you might have, and help connect you to a site, and ultimately, if you decide to participate. Additionally, there is a map of all participating sites on the website, along with the site staff's contact information. So if you already know which site you'd like to participate at, you can reach out directly by phone or email, and someone from the team will follow up with next steps.
Terrific. We'll put the link in our description here. And part of our description is that ALS United Mid-Atlantic serves people with ALS in Pennsylvania, New Jersey, and Delaware. So, are there sites in our areas where people can participate?
Yeah, so there's actually a bunch. There's two sites in Pennsylvania alone. These are Temple University and Penn State. So there's definitely options for people living in the New England area.
Great. I think this has been really helpful and wonderful discussion on observational research. Anything you want us to share for to close on this topic to let people know how they can be involved or about your work?
So I know we've covered a lot about observational research and the All ALS Consortium today. It's a lot to remember. So if you're going to walk away remembering one thing from this conversation, remember that observational research is a vital component of ALS research and drug and therapy development.
Yeah, and we'd also love to thank all the people listening today, whether you choose to get involved or not. Even just learning more about ALS and research really helps, especially if you talk to people about it. So we hope you learned a lot today, and if you have any questions, don't hesitate to reach out via the All ALS website, or so email us directly or fill out the interest form. Again, you can do that if you want to participate or even if you just have questions.
Thank you so much. I know that a lot of people hear research and they know about a lab, or they know about pictures of research or a video they saw, but they don't know how they themselves can be involved, and that they can make such a big difference in any kind of study to advance further knowledge and treatments for ALS. And research is so empowering, and ALS United Mid-Atlantic and our partners throughout the ALS United network are really working to make sure everyone who is interested in research can participate however they'd like to and how they feel comfortable. So, learning about this through your work means so much. If you're interested in learning about our work and supporting our mission, our website is alsmidatlantic.org, and you can follow us across social media platforms at ALS Mid-Atlantic. Please watch and share this video or podcast on Spotify and iTunes. Like and subscribe, leave a comment and a review. It helps us get more recognition and supports ALS awareness. Myah and Emma, I'm really excited that we have such young, smart people dedicated towards ALS research. It means so much to our audience to know that there are more people taking this seriously, and we're really grateful to the work you're doing.
Thank you. You as
Thank
well,
you.
Tony. You do so much. Thank you.
Well, no one has to do it all on their own. It's not on any one person's shoulders. And even this podcast is three of us. So the more people that are doing it together, it makes a difference. And you can make a difference at an upcoming ALS United event, like an ALS United walk, our annual celebration and luncheon, or various other events that you can do on your own. So whether it's fundraising, awareness, or research, we're all in this together. Again, visit alsmidatlantic.org for more information, and we'll share more work that Myah and Emma are doing as well. Thank you so much, guys. I look forward to speaking with you soon.